Your liver is working hard right now, performing over 500 essential functions to keep you alive. But here's the terrifying truth. Liver cancer is often called the silent killer, because by the time most people experience obvious symptoms, the disease has already progressed to advanced stages. But what if I told you there are early warning signs? Subtle clues your body gives you that most people dismiss as nothing serious? Today, we're uncovering the early signs of liver cancer that could save your life. Liver cancer, particularly hepatocellular carcinoma, or HCC, is the third leading cause of cancer deaths worldwide. The 5-year survival rate is about 20% overall, but when caught at early, localized stages, that survival rate jumps to 35%. And with newer treatments, some patients achieve even better outcomes. That's why recognizing these early warning signs is absolutely critical, especially if you're in a high-risk group. Let's dive into the signs you need to know. Before we get into specific symptoms, you need to understand why liver cancer is so hard to catch early. 3 key reasons. First, the liver has remarkable regenerative capacity. It can function normally even when up to 70 to 80% of it is damaged or diseased. This means symptoms often don't appear until significant damage has occurred. Second, the liver doesn't have pain receptors inside the organ itself. You only feel pain when the liver becomes enlarged enough to stretch the capsule surrounding it, or when the tumor affects nearby structures. Third, early symptoms are incredibly nonspecific. They mimic dozens of other common conditions, from indigestion to fatigue, making them easy to dismiss. But despite these challenges, there are signs. Let's explore them. The first early sign is unintentional weight loss combined with loss of appetite, particularly loss of interest in meat or protein-rich foods. What's happening? When liver cancer develops, it disrupts your liver's metabolic functions. Cancer cells also produce substances that affect your appetite centers and metabolism. The specifics to watch for: losing 10 pounds or more without trying over 3 to 6 months. Feeling full after eating very small amounts, early satiety. Sudden aversion to foods you previously enjoyed, especially meat. Feeling nauseated at the thought or smell of food. Why it's often missed. Many people actually welcome unexpected weight loss, thinking, "Finally, I'm losing weight without trying." This is dangerous thinking when it comes to unintentional weight loss. Critical distinction: normal age-related appetite changes are gradual. Cancer-related changes are typically more sudden and progressive. If you've lost weight without changing your diet or exercise routine, and especially if you're in a high-risk group for liver cancer, this deserves investigation. The second early warning sign is a vague but persistent discomfort in your upper right abdomen. Understanding the sensation: this isn't typically sharp pain in the early stages. Patients describe it as a dull ache or heaviness in the right upper abdomen, a feeling of fullness or bloating on the right side, discomfort that worsens after eating, a sensation of something pressing under the right rib cage. Why this occurs? As a tumor grows, it can cause the liver to enlarge slightly, stretching the membrane covering the liver, which DOEs have pain receptors. The diagnostic challenge: this type of discomfort is easily mistaken for indigestion, acid reflux, or gas. What makes it concerning? Persistent abdominal discomfort lasting more than 2 weeks, especially in the right upper quadrant, should prompt medical evaluation in high-risk individuals. Action point: if you experience persistent right upper abdominal discomfort for more than 2 weeks, Especially if you have risk factors for liver disease, request liver function tests and imaging. Don't let a doctor dismiss this as just indigestion without proper investigation. The third early sign involves subtle changes in your skin and eyes that you might not immediately recognize as jaundice. What to look for? Before obvious yellowing occurs, you might notice a slight yellowish tint to the whites of your eyes, skin taking on a faintly yellow or golden hue, unusual itching without a rash, particularly on the palms and soleus, darker urine resembling the color of tea or cola, pale or clay-colored stools. The medical explanation: jaundice occurs when bilirubin builds up in your blood. When a tumor blocks bile ducts or impairs liver function, bilirubin accumulates. The tricky part: early-stage jaundice is subtle. You might notice it first in the whites of your eyes before your skin, or changes in urine color before visible skin changes. Self-monitoring technique: check your eyes in natural daylight weekly. Monitor your urine color. It should be pale yellow. Note if you're scratching more than usual without obvious cause. The fourth early warning sign is profound fatigue that's disproportionate to your activity level. Understanding cancer-related fatigue: this isn't just feeling tired after a long day. It's overwhelming exhaustion that doesn't improve with rest. Feeling drained after minimal physical or mental activity. Difficulty concentrating or brain fog. Need to nap during the day despite adequate nighttime sleep. The biological basis: liver cancer causes fatigue through anemia, metabolic disruptions, and inflammatory substances produced by cancer cells. Critical distinctions: normal fatigue improves with rest. Cancer-related fatigue persists despite adequate rest, is disproportionate to activity level, and progressively worsens over weeks. What to do if you experience persistent unexplained fatigue lasting more than a month, particularly with other risk factors or symptoms? Request comprehensive blood work including complete blood count, liver function tests, the alpha-fetoprotein, AFP, a tumor marker for liver cancer. If you fall into any high-risk category, these early signs become even more significant. High-risk groups include people with chronic hepatitis B or C, those with cirrhosis from any cause, heavy alcohol users, people with non-alcoholic fatty liver disease (NAFLD), and individuals with diabetes and obesity. Early detection of liver cancer is challenging but not impossible. These 4 signs: unexplained weight loss, persistent upper abdominal discomfort, subtle yellowing or itching, and unusual fatigue are your body's early warning system. Your action plan: know your risk factors. Get tested for hepatitis B and C. If you're high risk, follow surveillance guidelines with 6-month imaging. For everyone, don't ignore persistent symptoms lasting more than 2 weeks. The golden rule: trust your instinct. Persistent changes deserve medical attention. Early detection dramatically improves outcomes. Your liver doesn't complain loudly, but it does whisper warnings. Learn to listen. Share this information with anyone